It's very similar to the process of working out a muscle. When you break down the tissue of the muscle, your body rebuilds it stronger, not only stronger muscle, but a bigger muscle the second time. Well, we're essentially doing that at a cellular level now. Hey everybody, this is Mike from Kalkstein Chiropractic, your Baltimore Towson local chiropractor. I've got Taylor here with me. You might have seen in a previous video, Taylor was having some treatment done on her for primarily that upper back. Some dry needling was done. Today we're going to be doing the follow-up treatment and doing a little bit more of a close, in-depth look at the Shockwave tool. So before we do anything on Taylor here, I'm going to go ahead and just give you a little bit of a walkthrough on what we've got here just on the back. So as you can see on the back here, we've got a couple different heads. Now basically what the heads do, keep in mind the Shockwave, in case you don't know, we're using a little tiny magnetic bullet, to make contact with these metal plates that are on the back of the head. And now depending on what head we use, depends on how dense we're going to send, or how deep we're going to send that acoustic sound wave. So for instance, this silicone head, it's obviously not very dense, whereas we have a head that is primarily made of gold, and it is going to be a little bit denser than that silicone head. So depending on where we're blasting, let's say we're going after the calf. Right now I've got this red head on right here, and this is kind of a medium density if you think about it as like a light, medium, or like a heavy. When we come down to the calf, which is going to be the second part of this video, we're going to end up using that gold head because the calf is a little bit more dense. There's a little bit more soft tissue than the scapula, the trap region that we're going to be blasting right now. So we kind of want to walk up in terms of pressure as opposed to starting too high and shocking Taylor or shocking the patient. We don't want the Shockwave to be an unpleasant time. Keep in mind it's not supposed to be super comfortable, but we want to keep the patient coming back. We don't want to hurt them too badly or shock them by any means. So that being said, we're going to go ahead and position ourselves to start the first round of treatment. And like I said, it's going to be on the scapula and the deltoid, the trap region. We're going to go ahead and fire it up. So it does sound kind of like a massage Theragun, a little bit of pressure at first. So it shouldn't feel too bad. Like I said, very similar to a Theragun when we're starting out, but we're going to slowly, Taylor, build to a 6 or a 7 in terms of pressure or pain, however you want to look at it. So again, not supposed to be super comfortable, but it's not going to be the end of the world by any means. So I'm going to slowly start to turn up that pressure now, Taylor. Okay. You just let me know whenever we're starting to hit, a 5 or a 6, or even if you find some spots. Ooh. I was just about to say, if I find some spots that are a little bit sensitive, Taylor will either let me know like that, or we might notice a little bit of a twitch, but that's basically Taylor's body telling us this is exactly where we need to be kind of attacking right now. To go back on what I said earlier with those acoustic sound waves, what are those sound waves doing when they're making contact with that magnetic bullet? Well, we're basically causing what we like to call in the office a micro trauma. Now, what's happening at the cellular level is those acoustic sound waves are going to kill off any cells in our targeted area, or essentially where this head is, and they're going to kill off any cells that are damaged or any cells that are dying off already. And now our body's response to that micro trauma happening is not only going to be to rejuvenate or regrow those cells, because we don't want just holes in all of our cellular makeup, but they're also going to make the cells stronger. It's very similar to the process of working out a muscle. When you break down the tissue of the muscle, your body rebuilds it stronger, not only stronger muscle, but a bigger muscle the second time. Well, we're essentially doing that at a cellular level now. So now that Taylor's gotten a little bit desensitized to that pressure that kind of gave us that reaction a second ago, I can slowly turn it up just a little bit more. Again, we don't want it to get super uncomfortable, but we can kind of fool the body now that it's kind of gotten used to what's going on and get a little bit more out of our treatment. So a typical treatment on the radial pulse Shockwave is going to be anywhere from about 4 minutes, all the way up to 7 or 8 minutes, depending on how many treatments you've gotten. Your initial treatment won't be lighter in the sense of pressure, but it will be a little bit more short, just to kind of warm the body up to the treatment itself, the exposure, kind of condition the body to everything that's happening. You know, we also want to see how you respond to it as well. So, for instance, some patients aren't very sore the next day, whereas other patients, they are particularly sore for about a 24-hour window. And then in the 48 to 72-hour window is usually when that soreness will go away, if you are experiencing any at all. The common thing, not only for Shockwave, but for the chiropractic procedure in general, or even our massage therapy, is always to just make sure that you're nice and hydrated going into the therapy, but also after as well, because that's going to play a big role in how our body is able to flush out all of the toxins and everything that we've kind of put into play here. So we've got about 2 minutes left on our treatment for the first round, and then after this we're going to clean up this area of Taylor, wipe off the ultrasound gel, and then we're going to go and attack that calf like I was talking about. So we'll get a part 2 video for a little bit different of a muscle group, and again we'll kind of go over the difference in those densities with the heads for what muscles we can use for the Shockwave.
I like this.
You're liking it so far, Taylor?
I'm liking it.
Good. Taylor was a little nervous coming into the session because this is her first time getting Shockwave, but like I said at the start of the video, you know, it's really good at attacking certain things, or even being paired with certain modalities like that dry needling that Taylor got earlier. So this will definitely help to speed up the recovery process. What do you think, Taylor? What does it feel like to you?
It feels like it's weird because it's like you hear the tapping noise, but it doesn't really feel like the tapping so much in the muscle. It's almost like I'm like using a lax ball. That's what it kind of feels like.
A lot of pressure going over the certain areas, huh?
It's almost like I'm, like foam rolling, but I'm not. That's what it feels like, kind of.
That's definitely a good descriptor for sure. We oftentimes will tell patients when we first turn it on, it sounds scarier than it feels, and you can probably even kind of see why, Taylor. Because when you first turn it on, it's really no difference than, you know, one of those massage guns that you would have at the house. It feels very, very, very light in a sense when you first turn it on.
Yeah, it's not really so much of the tapping. Like you hear the tapping, but it's not like you feel the tapping.
Yeah, so let's go ahead and clean up Taylor on this spot, and like I said, we'll start up a second video. We'll kind of do a little bit more on the calf area and just talk about that different head, because we will be changing from the red head to our gold head. All right, everybody, like I said, this is Michael from Kalkstein Chiropractic, your local Towson, Baltimore chiropractor. I've got Taylor with me. Like and follow for part 2.